I'm going to talk briefly about how inhaling works versus how exhaling works. This is an important contrast that you have in physiology for pulm. It's super important. So I'm going to talk about it. Inhale, I know this is super ugly and messy, but it's fine. Inhale versus exhale, right? These are the two sides of things that I'm contrasting on the left here versus on the right here. What's the main difference between inhaling and exhaling? Inhaling is an active process. Exhaling is a passive process. What does that mean? It means that you only use muscles to inhale. There are no muscles used for exhaling. Right? Inhale versus exhale is muscles versus recoil. Active versus passive. So you use your muscles to stretch your lungs open by stretching your chest wall open. That's how you inhale. Then the chest wall and the lungs bounce back to a closed position. Right? After being stretched open, they bounce back and become small again. That bounce back is what we call recoil. So when you're breathing, you don't actually breathe in and breathe out. It's more like you breathe in and then your lungs snap back and breathe out on their own. That's basically how it works. So in inhaling, you're using your chest wall, or it's the chest wall that's doing it. In exhaling, it's the lungs themselves that are doing it. This is another very important contrast, chest versus lung. The whole point is that these are the two opposite sides of this tug of war. So you have your lungs on this side, you have your chest wall on this side, and the whole idea is that they are basically connected by a rope, the pleura. The pleural lining that surrounds your lungs is attached to the lung and it's attached to the chest wall, so it connects them together. Because of this, when your chest wall, stretches outward and moves outward, your lung has to move with it, right? So when the chest wall right here moves outward, the lung right here gets pulled in that same direction. So when your chest wall gets bigger, so that when you're trying to inhale, that forces your lungs to also get bigger, which allows you to inhale because air gets pulled into that space. So inhaling is the chest dragging the lungs. See, the chest is the one actually doing the work. Exhaling is the opposite. It's the lungs dragging the chest wall, right? Because your lungs right here snap back and bounce back inward. And because these two guys are connected by a rope, the chest wall is also forced to be pulled inward. It's pulled inward by the lung. So because these two, the lung and the chest wall, are connected by a rope, they drag each other places. The chest wall drags the lungs out. That's called inhaling. Then the lungs, in return, drag the chest wall back in. That's called exhaling. So the most important thing here is to remember that these guys are connected by a rope, and to remember this list of contrasts that we have. Inhaling versus exhaling is active versus passive, is done by muscles versus done by recoil, right? As far as who's generating the force. The muscles generate the force for inhale, recoil generates the force for exhale. And it's performed by the chest wall, which have muscles, right? See? Versus the lungs, which don't have muscles. They have elastic fibers. See? The lung has elasticity, so it's able to recoil and bounce back. The chest wall has muscles, so it's able to pull itself outward. So that is the yin and yang here with inhale versus exhale. Inhale versus exhale, active versus passive, muscles versus recoil, chest wall versus lungs.